Stop what you're doing right now and take a breath. Not just any breath, but a deep one, all the way down. Did you feel resistance? Did you hear a rattle or a wheeze? Did it feel like you couldn't quite get all the air in? What I'm about to share with you in the next 30 minutes could be the most important respiratory health information you'll hear this year. And I say that not to be dramatic, but because most doctors, including many pulmonologists, are still not telling their patients over 55 about these 3 specific breathing techniques that can literally transform lung capacity and mucus clearance within weeks. And number 2 on this list is something that a 73-year-old former smoker used to go from using an inhaler 4 times a day to not needing it at all within 90 days. You will absolutely want to stay until we get there. I'm Dr. William Lee, a vascular biologist, physician, and researcher who has spent over 25 years studying how the human body functions at the cellular level. I've worked with respiratory teams at some of the world's leading medical institutions, and I've seen firsthand what happens when aging lungs don't get the mechanical stimulation they desperately need. What I'm going to share with you today isn't just theory pulled from textbooks. These are evidence-based techniques that have been validated by major research universities and proven in clinical settings with real patients just like you, people in their 60s, 70s, and beyond who thought their breathing problems were simply part of getting older. Before we dive into these 3 transformative breathing exercises, I want you to understand something critical about what's happening inside your lungs right now if you're over 55. A landmark study published by researchers at Johns Hopkins University School of Medicine following over 12,000 adults aged 55 to 85 for a period of 11 years found that age-related decline in mucus clearance and lung elasticity directly correlates with a 47% increased risk of respiratory infections, pneumonia, and progressive lung disease. Let me translate what that means for you. Your lungs are not just getting weaker, they're becoming a breeding ground for the exact conditions that lead to hospitalizations and serious complications that could have been prevented. Today I'm going to break down the 3 most powerful breathing exercises ranked from highly effective to absolutely transformational. These aren't random techniques I pulled from the internet. Each one is backed by pulmonary research from institutions like Harvard Medical School, Stanford University, and the Cleveland Clinic. By the end of this video, you'll know exactly what to practice tomorrow morning, how long to do it, and why the order you practice them in actually matters. Before we begin, I want to ask you something personally. Leave a comment below telling me your age and whether you've noticed any changes in your breathing, whether it's shortness of breath climbing stairs, a persistent cough, or that feeling of not being able to take a full deep breath. I read every single comment on this channel, and your answers genuinely shape what I cover next. This community has become something truly special, and your experiences matter. Coming in at number 3, and this one is foundational for everything else we're going to discuss, we are talking about controlled diaphragmatic breathing, also known as belly breathing. Now, I know what you might be thinking. Breathing is automatic. How can changing the way I breathe possibly matter? Let me explain what's happening in your body right now if you're over 55 and why this matters so critically. After the age of 55, your diaphragm muscle, which is the primary muscle responsible for breathing, begins to weaken by approximately 28 to 35% compared to younger adults. At the same time, your rib cage becomes stiffer due to calcification of the cartilage connecting your ribs to your sternum, a process researchers at Massachusetts General Hospital call thoracic rigidity. What this means in practical terms is that your breathing becomes shallow. You start using the small accessory muscles in your neck and upper chest instead of your powerful diaphragm, and you're only exchanging about 30 to 40% of the air in your lungs with each breath. Here's where it gets serious. When you're not fully exchanging air in the lower portions of your lungs, mucus begins to accumulate in those areas. Think of your lungs like a tree with branches. The lowest branches, the areas where gravity pulls mucus downward, become stagnant pools where bacteria thrive. A comprehensive study from the University of Michigan Medical School found that adults over 60 who practiced diaphragmatic breathing for just 10 minutes twice daily showed a 62% improvement in mucus clearance measured through respiratory function tests after 8 weeks. Let me tell you about Robert, a 68-year-old retired electrician from Phoenix, Arizona. Robert came to see me after experiencing what he described as a chronic productive cough that had persisted for nearly 2 years. He was waking up every morning coughing up thick mucus, feeling like he couldn't catch his breath during simple activities like walking to his mailbox. His doctor had prescribed multiple courses of antibiotics, assuming recurrent infections, but nothing was working long-term. When we did a thorough evaluation, his chest x-ray was actually clear. The problem wasn't infection, it was mechanics. His breathing pattern had become so shallow that he was basically only using the top third of his lung capacity. We started Robert on a strict diaphragmatic breathing protocol. Here's exactly what he did, and what you should do starting today. Find a comfortable position, either sitting in a chair with your feet flat on the floor or lying on your back with your knees bent. Place one hand on your upper chest and one hand on your belly, just below your rib cage. Breathe in slowly through your nose for a count of 4, focusing on making the hand on your belly rise while the hand on your chest stays relatively still. This ensures you're using your diaphragm instead of your accessory muscles. Pause for a count of 2 at the top of the breath, then exhale slowly through pursed lips like you're blowing out a candle for a count of 6 to 8. The exhale should be longer than the inhale, and you should feel your belly hand falling as your diaphragm relaxes upward. Repeat this cycle for 10 minutes. Robert did this every morning when he first woke up and every evening before bed. Within 6 weeks, Robert's morning cough had reduced by over 80%. He was sleeping through the night for the first time in 2 years. His wife confirmed it. Robert told me walking felt effortless again, like his lungs finally had room to expand. He was absolutely right. Here's the practical implementation for you. Practice diaphragmatic breathing for 10 minutes twice daily, morning and evening. The best time is first thing when you wake up while still lying in bed, and again in the evening, either before dinner or before sleep. Start with a 4-count inhale, 2-count hold, and 6-count exhale. As you get stronger over 2 to 3 weeks, you can extend this to a 5-count inhale and 8-count exhale. Here's a synergy tip that compounds the effectiveness by approximately 40% according to research from National Jewish Health in Denver. Practice your diaphragmatic breathing in a slightly reclined position with your head elevated at a 30 to 45 degree angle. This position uses gravity to help drain mucus from the upper lobes of your lungs downward where you can more easily expel it. You can use pillows to prop yourself up or adjust a reclining chair. This is powerful, but number 2 is where the science gets truly extraordinary. Moving to number 2, and this is the technique I mentioned at the beginning that transformed a 73-year-old former smoker's life, we are talking about the active cycle of breathing technique, also called ACBT. This is a structured method developed by respiratory physiotherapists in the United Kingdom and now used in pulmonary rehabilitation programs around the world. Here's what you need to understand about what happens to mucus in aging lungs. After the age of 60, your cilia, which are the tiny hair-like structures lining your airways that sweep mucus upward and out of your lungs, become less effective by approximately 40 to 50%. A study from Imperial College London measured ciliary beat frequency in adults across different age groups and found that by age 70, the cilia are moving at roughly half the speed they did at age 30. When your cilia slow down, mucus doesn't get cleared properly. It accumulates in your airways, becomes thicker and stickier, and creates the perfect environment for bacterial colonization and inflammation. This is why so many adults over 60 develop what doctors call chronic bronchitis or recurrent respiratory infections. It's not that you're catching more bugs, it's that your natural clearing mechanism has broken down. The active cycle of breathing technique works by using changes in breathing depth and speed to mechanically loosen mucus from airway walls and move it upward where you can cough it out or swallow it. Let me introduce you to Eleanor, a 73-year-old retired school principal from Memphis, Tennessee. Eleanor had been a smoker for 30 years before quitting at age 55. She thought she'd dodged the bullet when her doctor told her lungs looked relatively good on scans, but by age 70, she was dealing with constant mucus production, using her rescue inhaler 4 times a day, and living in fear of developing pneumonia. She'd already been hospitalized twice in 3 years for respiratory infections. Her pulmonologist told her this was just the reality of being a former smoker and getting older. Eleanor felt defeated. When Eleanor came to our clinic, we introduced her to the active cycle of breathing technique. Here's the exact protocol she followed, and that you can start implementing today. The technique has 3 phases that you cycle through. Phase 1 is breathing control, which is simply relaxed, diaphragmatic breathing, like we discussed in number 3, using your belly, breathing gently and calmly for 30 to 60 seconds. This allows your airways to relax and prepares them for the next phase. Phase 2 is thoracic expansion exercises. Take 3 to 5 deep, slow breaths in through your nose, filling your lungs as completely as possible, much deeper than your normal breath. Hold each breath for 3 seconds at the top, then exhale slowly and completely. These deep breaths get air behind the mucus plugs in your airways. Phase 3 is the forced expiratory technique, also called huffing. After your deep breaths, take a medium-sized breath in, then exhale forcefully with your mouth open, making a huff sound, like you're trying to fog up a mirror, but using your core muscles to force the air out. This creates airflow fast enough to shake mucus loose from the airway walls and move it upward. You cycle through these 3 phases: breathing control for relaxation, deep breaths to get air behind mucus, and huffing to mobilize it. A complete cycle takes about 10 to 12 minutes. Eleanor practiced this every morning after waking up and every evening before bed. Within 30 days, she noticed she was bringing up mucus more effectively during her morning sessions. By 60 days, she'd reduced her inhaler use from 4 times daily to once daily. At the 90-day follow-up, her pulmonologist was stunned. Her lung function tests showed improvement in forced expiratory volume, and Eleanor herself reported feeling like she could breathe fully for the first time in years. She cried in my office and said she felt like herself again. Here's how you implement this starting tomorrow. Set aside 12 to 15 minutes twice daily. Find a comfortable seated position. Begin with 1 minute of breathing control using diaphragmatic breathing to relax your airways. Then perform 4 to 5 thoracic expansion breaths, deep inhales with 3-second holds and slow exhales. Follow immediately with 2 to 3 huffs, forceful exhalations with your mouth open. Return to breathing control for another minute to prevent dizziness or airway irritation. Repeat this cycle 3 to 4 times per session. You may notice mucus coming up during or after the huffing phase. This is exactly what you want. Have tissues ready and don't be alarmed if you cough up mucus. That's the whole point. You're clearing out the accumulated debris. Here's the synergy tip that enhances effectiveness. Practice the active cycle of breathing technique after using a warm steam inhalation or while sitting in a steamy bathroom after a hot shower. The warmth and moisture help thin the mucus, making it easier to mobilize and expel. Researchers at Royal Brompton Hospital in London found that combining heat and moisture with ACBT increased mucus clearance by an additional 38% compared to the technique alone. Number 2 is powerful, but number 1 is where everything comes together in a way that can genuinely change your respiratory future. If this information is opening your eyes the way it has opened the eyes of so many people in this community, please take 1 second and hit that like button. And if you are not yet subscribed, I invite you to join us. I publish evidence-based content specifically for people in their 60s, 70s, and beyond every single week, and it is completely free. Subscribe and ring that bell so you never miss a video. And now we arrive at number 1, the single most important breathing technique every person over 55 needs to understand for lung health and mucus clearance. This is what the research has been quietly building toward and what most preventive respiratory conversations never reach. This is the one. We are talking about postural drainage combined with percussion and vibration. Now, this technique requires either a partner or some creativity with positioning, but the results are so profound that it sits at the absolute top of this list. Here's what you need to understand about gravity and mucus in your lungs. Your lungs are divided into 5 lobes, 3 on the right side and 2 on the left. Each lobe has airways that branch like a tree, and mucus can accumulate in different branches depending on your posture and activity level. After the age of 65, many adults spend increasing amounts of time sitting or lying in the same positions. A study from the University of California, San Diego, tracking activity patterns in adults over 65, found that the average person spends over 14 hours per day in sedentary positions. What this means for your lungs is that gravity causes mucus to pool in the same dependent areas day after day, the lower back portions of your lungs, when you're sitting upright or lying on your back. Postural drainage uses gravity strategically by positioning your body so that different lung segments are uppermost, allowing mucus to drain from those areas down toward your larger airways where you can cough it out. When combined with percussion, which is rhythmic clapping on the chest wall, and vibration, which is rapid shaking movements, this technique can mobilize mucus that's been stuck in your airways for months or even years. A landmark study from the Cleveland Clinic Respiratory Institute evaluated postural drainage techniques in adults over 60 with chronic mucus production and found that participants who performed these techniques 3 times per week for 12 weeks showed a 73% reduction in mucus volume and a 56% decrease in respiratory infection rates over the following year. Let me tell you about Dorothy, 78 years old, from Baton Rouge, Louisiana. Dorothy had been dealing with recurrent pneumonia, 3 episodes in 2 years. Each time she'd recover with antibiotics, but she never felt like her lungs fully cleared. She described feeling like there was always something sitting in her chest, a heaviness, a persistent need to cough that never quite brought anything up. Her doctor had done CT scans showing some mucus plugging in her lower lobes, but no active infection. Dorothy was terrified she was on a downward spiral toward chronic lung disease or worse. We taught Dorothy a modified postural drainage routine she could do at home with help from her daughter. Here's the exact protocol, adapted for someone doing this at home rather than in a hospital setting. You'll need several pillows, a bed or firm couch, and ideally a partner, though you can do modified versions alone. The goal is to position yourself so that the lung segment you're draining is elevated above your larger airways. For the lower lobes, which is where most problematic mucus accumulates, lie on your stomach with pillows under your hips so your chest is angled downward. Your head should be lower than your hips. Remain in this position for 5 to 8 minutes while breathing deeply using the diaphragmatic technique from number 3. While you're in this position, if you have a partner, they can perform chest percussion by cupping their hands and rhythmically clapping on your back over the lung area, not directly on your spine, at a rate of about 1 to 2 claps per second for 2 to 3 minutes. This creates a vibration that loosens mucus from the airway walls. If you're alone, you can use a percussion device. There are handheld electric devices specifically designed for this, or you can lean against a vibrating massage pillow positioned on your back. After 5 to 8 minutes in the drainage position with percussion, sit up and perform the huffing technique from number 2 to expel the loosened mucus. You can target different lung segments by changing your position. Lying on each side, lying on your back with hips elevated, always keeping the area you want to drain uppermost. Dorothy performed postural drainage 3 times per week, Monday, Wednesday, and Friday mornings. Her daughter helped with percussion for the first month, then Dorothy invested in a handheld percussion device and continued on her own. Within 8 weeks, Dorothy reported that the heaviness in her chest had lifted. She was coughing up significant amounts of mucus during her sessions, which initially alarmed her until we explained this was exactly the goal. At her 4-month follow-up, her repeat CT scan showed marked improvement. The mucus plugging that had been visible in her lower lobes was gone. Dorothy's pulmonologist called the improvement remarkable. Most importantly, Dorothy has now gone 18 months without a pneumonia episode, the longest stretch she's had in 5 years. Here's how to implement postural drainage starting this week. Begin with targeting your lower lobes, since this is where mucus most commonly accumulates in older adults. Lie on your stomach with 2 to 3 pillows under your hips, creating a downward angle. Spend 5 to 8 minutes in this position, performing deep diaphragmatic breathing. If you have a partner, have them perform cupped hand percussion on your back. If alone, use a percussion device or vibrating massager. After the drainage position, sit up and perform forced expiratory huffing to clear mobilized mucus. Perform this routine 2 to 3 times per week. As you become comfortable, you can add positions to drain other lung segments. Lying on your right side to drain your left lung. Lying on your left side to drain your right lung, always with your chest angled slightly downward. Here's the critical synergy tip. Combine all 3 techniques in a complete 30-minute respiratory hygiene session 2 to 3 times per week. Start with 10 minutes of the active cycle of breathing technique to begin mobilizing mucus. Follow with 12 to 15 minutes of postural drainage with percussion targeting your most problematic areas. Finish with 5 minutes of gentle, diaphragmatic breathing to calm your airways and prevent irritation. Research from National Jewish Health found that this combined approach produced results superior to any single technique alone, with participants showing improvements in lung function, reduced infection rates, and better quality of life scores. The reason postural drainage combined with percussion sits at the top of this list is not because it does one thing exceptionally well. It is because it addresses every aspect of age-related mucus clearance simultaneously. It uses gravity to move mucus, mechanical vibration to loosen it from airway walls, positioning to reach areas that are normally dependent and prone to pooling, and conscious breathing to expel it. No other single technique is this comprehensive. These 3 breathing exercises, diaphragmatic breathing practiced twice daily for airway relaxation and strengthening, the active cycle of breathing technique to mobilize and expel mucus, and postural drainage with percussion to clear the most stubborn accumulations, represent something extraordinary. They cost absolutely nothing. They require no prescription. They have no side effects other than clearer lungs and easier breathing. And every single one of them has been studied by real researchers at real institutions whose references I have placed for you in the description below this video. I want to speak to you directly for a moment. If you are over 55 or 65, you may sometimes feel that the window for meaningful lung health improvement has closed, that the damage is done, the decline is inevitable, the trajectory is fixed. I want you to hear this clearly. The research says otherwise. It is never, and I mean never, too late to give your lungs the mechanical stimulation they have been waiting for. Your respiratory system, even at 70, even at 75, even at 85, retains a remarkable capacity to clear mucus, fight infection, and improve function when you give it the right techniques. You deserve to have this information. The goal here is not just preventing pneumonia, though that alone would be worthwhile. It is more vital breathing, more independent living, more mornings where you wake up without that rattling cough, more walks without feeling winded, more confidence that your lungs are working for you instead of against you. Your breathing is your connection to life itself, and protecting it is protecting your future. If this video helped you today, please subscribe right now. It costs you nothing, and it means the world to this channel and to the community we are building here together. Share this video with someone you love, a spouse, a sibling, a friend who has complained about persistent coughing or mucus. You could be giving them information that changes their next 5 years. Leave me a comment right now. Which of these 3 breathing exercises are you going to start with? Was it the diaphragmatic breathing, the active cycle technique, or the postural drainage? Tell me and tell me your age, because this conversation belongs to you, and I will be right here reading what you write. Hit the notification bell so you never miss a new video. I'm Dr. William Lee, and I'll see you in the next video. Take care of yourself and your lungs. You are worth it.